Electrical activity. Our brain cells talk to each other using tiny electrical signals. Electroencephalogram helps us see these signals. It is a key tool for doctors. This test provides a window into the brain's function. Small sensors called electrodes are placed on your scalp. They detect very small electrical charges from your brain cells. The activity is recorded as waves, showing patterns of brain function. Electroencephalogram is a non-invasive and painless procedure. It only listens to your brain's natural signals. This makes it very useful in medicine. Electroencephalogram helps doctors diagnose many conditions like epilepsy and sleep disorders. It also helps researchers study brain function. This test provides valuable insights. It can track changes in brain activity over time. Preparing for an electroencephalogram is simple. Your hair must be clean and dry. Avoid oils, sprays, and conditioners. Clean hair helps electrodes stick properly. Avoid caffeine before the test. This means no coffee, tea, or fizzy drinks for about 8 to 12 hours. Try to get a good night's sleep unless your doctor plans a sleep-deprived electroencephalogram. Certain medications might need to be paused. Consult your doctor. Informed consent is a crucial step. The electroencephalogram procedure will be explained, and you can ask any questions. Your agreement will then be documented. The electroencephalogram test happens in a calm, quiet room. You will usually sit in a reclining chair or lie down on a bed. Staying relaxed is very important. A calm setting helps get accurate readings. The technician will ensure your comfort. The environment is optimized for reliable data collection. Precise electrode placement is essential for accuracy in the electroencephalogram. The brain has many distinct regions, each performing different tasks. Correct placement helps map these activities. Technicians often use the 10-20 system, an international standard. The head is measured carefully, and specific marks are made on the scalp. Electrodes are attached to these points. This system ensures consistent results. The process starts with measuring your head. A technician uses a tape measure to identify key skull landmarks. These include the nasion near your nose and the inion at the back of your head. Distances between these points are measured to mark electrode positions. Next, the marked spots are cleaned. A special cleaning gel might be used to gently exfoliate the skin. Clean skin provides good electrical contact. This is crucial for high-quality electroencephalogram signals. Ensuring quality impedance checks and electrode types. Various types of electrodes are available, like individual small metal discs or elastic caps. The choice depends on the clinic and test requirements. Securing electrodes correctly is important. Disc electrodes use a conductive paste or gel to stick to the scalp. Electrodes in a cap fit snugly against the head. Good, stable contact prevents signals from being lost or distorted. Impedance is a measure of electrical resistance. For electroencephalogram, we need low impedance values. High impedance means a poor connection between scalp and electrode. The technician checks impedance for each electrode. The electroencephalogram machine itself checks impedance before the recording begins. If impedance is too high, adjustments are made. The technician might re-clean the scalp area or add more conductive paste. This careful process ensures the best possible signal quality for accurate diagnosis. The recording session capturing brain activity. Once electrodes are secure and impedance is good, recording starts. You will be asked to relax and stay as still as possible. You might need to keep your eyes closed initially. The technician watches the brain wave patterns on a screen. A routine electroencephalogram typically lasts 20 to 40 minutes. Some recordings for sleep studies can be much longer. The technician will guide you with instructions. They might ask you to open and close your eyes or do deep breathing exercises. A flashing light, known as photic stimulation, may be used. These tasks can reveal brain patterns not seen at rest. The technician carefully monitors you and the electroencephalogram signals in real time. Any movements are noted down as they can create electrical signals called artifacts. Sometimes video is recorded simultaneously with the electroencephalogram. This is especially helpful for diagnosing and characterizing epilepsy. After the recording, data handling and initial processing. When the recording is complete, the electrodes are removed. If individual electrodes and paste were used, this is cleaned off. The technician will gently clean your scalp. Warm water and a cloth are often used. The removal process is usually quick and painless. You can typically resume your normal activities immediately after the test. The recorded electroencephalogram data is very important clinical information. It is stored safely and securely. Modern electroencephalogram machines produce digital files saved on secure hospital systems. Hospitals follow strict privacy regulations to protect patient information. Raw electroencephalogram data requires initial processing and review. A trained electroencephalogram technologist often performs this first pass. They identify and mark any artifacts present. This prepares the data for expert review by a neurologist. Unlocking insights, advanced analysis, and diagnostic impact. A neurologist, a doctor specialized in brain disorders, analyzes the electroencephalogram. They recognize specific patterns in brain waves. Brain waves have different speeds or frequencies, known as alpha, beta, theta, and delta waves. The presence, absence, or abnormality of these patterns can suggest specific conditions. Sometimes, more advanced analysis is performed on the electroencephalogram data. Techniques like quantitative electroencephalogram or EEG can be used. This involves sophisticated computer processing of the signals. It can create brain maps showing the distribution of activity. Another technique is source localization, pinpointing the origin of specific brain signals. These methods offer more detailed information. After a thorough analysis, the neurologist prepares a written report. This report details all the significant findings from the electroencephalogram. It aids in diagnosis and subsequent treatment planning. Electroencephalogram significantly improves our understanding of many brain disorders.